This one simple change could probably add an additional 100,000 a year to your single owner operator physical therapy practice with no extra work, no extra frustration, and probably better patient outcomes. Let's dive into it and let's take a look at what I'm suggesting. Hey guys, if you don't know me, my name's Tony Maritato. I'm a licensed physical therapist and private practice owner. And I want to talk about a concept that I've shared a couple times before, but I'm going to explain how a program like this gets rolled out. I have a physical therapy clinic, but some of you might be operating a mobile physical therapy practice, which means you're treating patients in the patient's home. This business strategy will work for either business model. You could be in the clinic or you could be in the patient's home. It really doesn't make a difference. So what I'm talking about is including telehealth micro sessions to supplement your in-person physical therapy. And I'm going to talk about Medicare Part B specifically, but this might even apply to some of the other third-party payers. It just depends on whether they're covering telehealth services at this time. As of today, physical therapy delivered through a telehealth platform is still covered by Medicare Part B through the end of 2024. Right now, it's April 3rd, so we have a few more months ahead of us. We can capitalize on this, improve patient outcomes, improve profitability. It just works across the board. So let me talk to you about how something like this could be rolled out. And I'm going to do it from my perspective as a private practice clinic owner. So a patient comes to me for the first time getting a physical therapy evaluation. Let's take something simple. If you guys follow my content, you know that I tend to focus on post-surgical care following a total knee replacement. So a patient gets referred to me. I see them 24 to 48 hours following their total knee replacement. Now we know that they're not driving, so they're struggling to come to outpatient physical therapy. Maybe they're doing well, but not as well as they would like. So what I do is I do the initial evaluation in my clinic. They can usually find somebody who can bring them to my clinic the first time. We spend about an hour. I do a comprehensive evaluation, everything you would normally do. But at some point during that first session, I make sure that there is a way for me to connect with them through a HIPAA-compliant telehealth platform tomorrow, the day after the initial evaluation. I set everything up. I make it push button connectivity to make it as easy as possible. And I would tell you, if you're making an extra 100,000 a year in profit, you might even go out and purchase devices just so that you can ensure your patient has the ability to connect with you in this way. It's worth the investment. But basically, after my first initial session in person, I've set everything up. The patient just has to push the button when I initiate the contact tomorrow. And then what happens is tomorrow, at some point during my schedule, usually when I have a lull in the schedule, maybe a patient's running late, maybe there was a cancellation, maybe I just have a break. I don't have to work every minute of every day. So maybe I have a break. I initiate the telehealth session with the patient I evaluated yesterday. And during yesterday's evaluation, obviously we're looking at functional activities. Maybe one of the functional deficits that was identified was my patient has a hard time with sit-to-stand transfers. And now that patient's at home, they're in a recliner. They just had a knee replacement. They're probably sleeping in the recliner, spending parts of their day in the recliner between episodes of getting up, moving around. So one of the things that I'm going to look at on this particular acute or micro session is their ability to sit to stand transfer from the recliner. It's a specific functional task that was identified to be deficient that I expect to get back to independent with, no limitation. So it was identified in my evaluation. It was identified in my plan of care. And now today's session, we're solely focusing 8 to 22 minutes on improving the patient's ability to do this. Now, yesterday in the clinic, I evaluated them in a standard waiting room chair. But today, with the telehealth platform set up, I can evaluate them in their actual chair, in their actual environment. And so I initiate the call. We start to talk. How are you feeling? How'd you respond to yesterday? Any soreness, any problems, any questions that came up following the evaluation? Because we know the patient forgets all of their questions during the evaluation, but they get home and they all come flooding back. So once I get through that, I say, that's great. Go ahead and set up the phone. Let me see you stand from the recliner you're sitting in. And it gives me a chance to assess. It gives me a chance to educate, to provide verbal cueing to say, well, maybe try this or do that, or take your time with it. I spend 8 to 22 minutes, depending on what was done. In the example I just shared, it's close to a therapeutic activity procedure. So that's what I bill. And now I've just generated a micro session, a single unit treatment that was enough time and education for me to bill a unit of therapeutic activity. What's beautiful about this is if I had to go to the patient's home, the time in commute and the scheduling and the logistics, I would probably have to be there for an hour for me to make it financially viable. But because I'm doing this through a telehealth platform, I can be there for 10 minutes. I can deliver a quality service in those 10 minutes. I can make it fit within my daily work schedule. So maybe I can't block out an hour of time, but I've got 10 minutes between sessions that I can use. And it reduces the barriers for that patient to get answers to their questions, to get coaching, to get education and information that they otherwise need. So better experience for the patient, more profitability for me. Because it's a single unit session, I don't have any MPPR reduction. If you don't know what MPPR is, go ahead and search the channel. I've got other videos that explain, but it's a major, major reduction that happens when you bill more than a single unit or a single procedure code in a treatment session. So I eliminate MPPR. And if you do the math, I'll just do some quick math back of the napkin. If I was doing a 4-unit session with a single patient, typically the first unit, let's say the allowed amount for therapeutic activity is $38, I would get paid that full allowed amount. But then once I do a second, third, fourth unit, whether it's the same procedure or different procedure codes, they're all going to be reduced. My total reduction on a 1-hour treatment is going to be around 24%. So that means I'm averaging about $100 to $115 per session if I treat one patient for 4 units. But if I do 4 micro sessions through a telehealth platform, I eliminate that 24% reduction. Now, instead of getting $38 on the first unit, $30 on subsequent units, I'm getting $38 on every single one of those 4 units. I just increased my revenue, all profit, by 8, 16, 20, $24 without changing anything. And by increasing or improving my patient care experience, by providing more resources to patients, not just seeing them once or twice a week, but by being able to provide them with additional touch points, get to problems quicker, reduce barriers to therapy, like all of the stuff that we want to do. So if you need to learn more about single unit sessions, if you want to understand how to make this model work, you need to start practicing, you need to start playing with it, but I'm happy to answer those questions. So throw those questions in the comments and I'll see you on the next video.